When you hear the word cancer, your world stops. But for families in South Central Iowa, the hardest part isn't just the diagnosis, it's the drive. Most radiation treatments last 5 to 8 weeks. That's thousands of miles and dozens of hours away from home, family, and rest.
Hi, my name is Bob Cruz. I'm the CEO of Pella Regional Health Center, and I've had the privilege to serve this organization since 1993.
I'm Kevin Kincaid. I'm the CEO of Knoxville Hospital and Clinics, and I've been in that position since August of 2011.
We found out through our medical oncology group that we both work with that we both had aspirations to be able to take cancer care to a higher level, to be more comprehensive in our area. And by doing so, we would need to add the radiation portion of that situation. And when we found out we were both going to do it, we both paused and thought, hey, maybe this is something where we should maybe try work together on that, because we could have a broader audience, but we could serve both of our organizational needs very well that way without a costly duplication.
My name is Catherine Dvorak. I'm a physician here at Knoxville Hospital and Clinics. Having a cancer radiation center here is important to our community because currently patients are having to travel all the way up to Des Moines if they need radiation treatment. That's, for a lot of patients, that is every single day, 5 times a week for multiple weeks on end, and that's a huge burden on our patients.
I'm Mike Montgomery, and I've spent my career here between Knoxville and Pella, and now I'm excited to join the fundraising team raising money for the Radiation Center. Personally, I got involved in this campaign because over the course of the last 10 years, I had been active in taking 3 of my relatives to radiation treatments. It's a big deal for families. And having a radiation center here that could serve the needs of 6 area counties would certainly be a benefit to the people in this part of Iowa.
Providing care locally when you can do it in a high quality manner is better care. It's better for the family. And so for us to be able to do this is just going to be a true blessing for those that have been given this very tough diagnosis.
My name is Dr. Craig Winberg. I'm a family physician here at Pella Regional Health Center. I'm also Chief Medical Officer here, so I kind of wear 2 different hats. We have a lot of cancer, unfortunately, in our region of Iowa. I think is the 2nd highest cancer rate in the nation, and I think Marion County is the 13th highest cancer rate in the state of Iowa. So we all have a lot of patients who are dealing with these issues, whether it's breast cancer or lung cancer or things like that. So I think we're all excited just because it'll be better for all of our patients and hopefully for the whole region.
When you have competing organizations, you will find competing worldviews. And you simply do not find that between the Knoxville Hospital and the Pella Hospital, is that we both have this common thread that we want to take care of our community. And that is up at the forefront, and competition is way in the back. It makes it easy.
One of the things that I'm personally excited about is that we're going to be meeting with the doctors in Knoxville and developing a relationship where we're working together with various projects.
I think it's just emblematic of the fact that, these 2 health systems are trying to come together to offer something locally to our patients that is going to benefit so many people.
I think the partnership between Knoxville and Pella is very beneficial. 2 progressive towns coming together, working together, to benefit the citizens of Marion County. It's a good feeling.
My patients will be cared for much better just from a standpoint of their physical health and strength and everything, not having to go back and forth to Des Moines so often.
The center will help us deliver even more compassionate care to our patients by allowing them to receive local radiation treatment as well as care from local people.
As we've been planning this, we have tried to talk to experts across the state that are already doing this care to make sure that the equipment and the staff and everything that goes around it is as high a quality as they could get anywhere. So that's what we'll be striving for.
If I could say one thing to someone considering giving to this project, it would be that you absolutely know someone who's going to benefit from that gift. There's going to be someone in your life, whether it's, your friend's parent or sibling or the mailman or the person that you see at Hy-Vee every week. there's someone in your life who's going to benefit from that gift, who's going to need radiation at some point in their life.
So it's absolutely critical for the success of this that people do find in their heart ways that they can help financially support this. It'll make a huge difference in the outcome.
Our communities have supported us in the past. They choose us when they can, and that makes that difference. And so what we would like to do is ask people, if you have the ability to do so, this is a great place to step forward and help us get this done.